Here are a few tips on how to prepare for birth. No matter what kind of birth that you're choosing to have, whether it's vaginal or C-section, maybe it's a surprise C-section, there's plenty that we can do to help you get through your pregnancy and through the labor process. Number one, breath work. Breath work is not only important for helping to calm down the nervous system and therefore bring down your anxiety and help with the labor process, but it also is really, really important to maintain intra-abdominal pressure for managing the abdomen to reduce your risk of a diastasis. Breathwork is really important to ensure that you're able to get 360 breathing throughout the entire trunk. And it's also really important to make sure proper functioning of the pelvic floor. Number two, pelvic floor physical therapy. I may come off as a little biased because I'm also a pelvic PT, but I highly recommend doing pelvic PT. I'm still utilizing my colleagues to help me ensure that I am in the best shape as my pregnancy progresses and going into labor. Pelvic PT is really, really helpful for many reasons. For some people, it could be if you're having any low back pain, SI joint pain, pubic symphysis pain, hip pain, coming into physical therapy to help you figure out, okay, what exactly is mechanically going on so that we can help you go through multiple phases of pregnancy, especially as the baby is larger, can be really, really helpful. The next part is ensuring that you are staying strong and mobile and showing patients how to modify exercises as needed, especially if you're experiencing any pain. We want to make sure that you can do specific kinds of strengthening while also ensuring that your risk of re-injuring yourself or making more injuries is a lot lower. Pelvic PT is also really helpful from an educational standpoint. Here at Sarton Physical Therapy, we are always educating our patients on what to expect through each phase of pregnancy, on how to function in daily life to reduce your risk of further injury. And then we're also going to educate our patients on what to expect during labor, options during labor, and what to expect in the postpartum and how to care for yourself postpartum before coming back to PT when you're cleared by your doctor. Number three, going along with pelvic floor PT is ensuring that you have good hip mobility within limits. So this is really important for a couple of reasons. The reason why I say within limits is because as our pregnancy progresses, we get relaxin hormone flowing through us, and that just makes everything a little bit looser. The ligaments get a little bit looser, the joints are able to move a little bit bigger. So we want to make sure that, yes, while we're maintaining good hip mobility, we're still maintaining good stability. Because if we're trying to push into too much mobility when we're not really meant to, we can cause some issues too. When it comes to hip mobility, there's a couple of reasons why it's important to address. So first one is going to be, as our babies get larger, our base of support and our center of gravity changes. And you'll notice that as you progress, your feet want to turn out a little bit more, in what we call external rotation. So as we start to externally rotate our feet habitually, the muscles back here that are meant to put you into external rotation, they start to shorten and they get really tight. And sometimes that can sit on sciatic nerve. If you're experiencing that shooting pain in your butt and sometimes down your leg, that could be one of the main culprits. You want to educate yourself on how to maintain that good hip mobility through here. Also, when you maintain good hip mobility, you are able to create opening of the pelvis. So you can, by using your hips, you can open the inlet through here, and you can open the outlet through here. Number four, hypnobirthing. Hypnobirthing is a set of techniques that include self-hypnosis and other techniques such as affirmations, deep breathing, to help manage pain and anxiety during the labor process. While it's helpful during the labor process, it's even more helpful if you can start earlier in your pregnancy to practice those affirmations and to practice those self-hypnosis tracks so that when it comes down to labor, your brain knows exactly what it needs to do when you take yourself through those tracks. Hypnobirthing can be helpful for patients who are undergoing vaginal birth, whether or not with epidural, without epidural, or even somebody with a C-section. This could also be really helpful for somebody who is intending to go in through vaginal birth and for whatever reason has to go into a C-section without having that being planned out already. That will definitely help bring down the stress. Number five, massage therapy. As a physical therapist, I had a lot of questions about whether or not by pregnant patients, not pregnant patients, should I be doing massage? And my answer is always yes. It's not just the physical portion of it, it's the mental portion of it. Do what you need to do to create more mobility, create space, create time for yourself to help relax, bring up that oxytocin, and get muscles to relax. Number 6, knowing when to modify. As the pregnancy progresses, there's a lot more demands on your abdomen. So you'll notice that we have to modify how we do simple things in life. How do we get out of bed? How do we get out of a chair? How do we get out of the car? How are we squatting down to the ground? How are we picking up our other kids? How are we, walking? We need to know when to modify, and physical therapy, pelvic PT, will help you create those boundaries and give you alternative methods and modifications on how to modify. This not only includes just your normal activities of daily life, but let's just say you want to exercise and you had a specific exercise routine. We can guide you on how to make modifications to those exercises so that you're still being productive while protecting your body. And number 7, and I think as a pelvic PT, one of the most important things is how to avoid diastasis. A diastasis recti is a separation between that white line between the two six-pack muscles, where you sometimes can see that coning. Pretty much every person, every woman who is in their 3rd trimester will have some form of a diastasis. You may see it in the form of coning. Postpartum, you might see it in the form of sinking down, but there's a softness to it. And it's really important to manage that diastasis because it is a reflection of how we've been managing intra-abdominal pressures and how we've been using our deep abdominal muscles to help create stability for our own bodies and for the baby. There are certain movements that can make it more apparent. This is why we are told not to do sit-ups as our pregnancy progresses, because if not done correctly, then the coning can start occurring and we could just make that diastasis a little worse every time we do it if we're not doing it correctly. Again, this brings me to my earlier point about modifying exercises to ensure that we're not creating more of a diastasis and ensuring that we are using our deep core muscle. When in doubt, if you ever feel like you're not really sure what's going on, you're not sure if you're doing it right, I even do that all the time. I'm still asking my colleagues on whether or not I'm activating my deep core properly. If you're having any doubts about what you're doing, if you want to be a little bit more educated, I highly recommend seeing a pelvic floor physical therapist or a doula. Let us know what kind of prep that you've been doing for your birth and what's helped you and what hasn't helped you. And then share this with your friends, family, anybody who is looking to get pregnant or is pregnant who might be able to use some of these tips.